Assalamualaikum and my name is BJIB2033. My metric number is 278044. Today, I will be presenting about introduction to our topic, which is telemedicine in healthcare. What is telemedicine? Telemedicine is the application of technology and communication system to deliver information in the area of healthcare in many different ways. This has revolutionized medical care. Thanks to the huge changes in the world of ICT, the new IT-based industry, such as telemedicine, will take place in allowing efficiency, cost management, providing products depending on consumer requirement, and versatility of responsiveness. Telemedicine includes the full spectrum of health activities, including disease detection and prevention. With telemedicine, present method of face-to-face consultation is not necessarily anymore, as these technologies such as video calling, online website that can be accessed through smartphone or computer have made it possible. Considering the current condition of COVID-19, telemedicine is an efficient option and much more safer.
Assalamualaikum and good day everyone. My name is Natasha Izani binti Zakisha, metric number 277484. Today I will present about usage and application of telemedicine. Telemedicine have been using in these recent years, but because of COVID-19 pandemic, it has played important roles which give solution to some problems. Telemedicine can reduce trips to the emergency department of the hospital, maintain medical treatment, and decrease the spread of COVID-19 and others. All of this is the advantage of telemedicine during COVID-19. However, telemedicine should give good service, as this will increase the satisfaction of patients and give benefits effectively and efficiently. Thus, before using telemedicine, the guidelines of telemedicine application is needed to give good service. The United States, China, Australia, France, and Malaysia. These are some examples of countries that are using telemedicine. In the United States, their physicians use video conferencing applications such as Skype for Business, Microsoft Teams, UpDocs, or VC, which is provided for in the Health Insurance Portability and Transparency Act (HIPAA). Other non-HIPAA compliant tools such as FaceTime, Zoom, Cisco WebEx are now temporary use in telemedicine. While in China, Sichuan University Hospital in West China cooperated with the ZTE Corporation to fulfill telemedicine service using 5G technology. Next, the Australian government has given funds for Medicare telemedicine service to enable physicians to assist in the provision of medical service. Besides that, France has more than 10 telemedicine platforms that provide service to patients, showing that telemedicine can become a commercially viable option beyond COVID-19. Lastly, Dr. On-Call and Telemed are some examples of telemedicine in Malaysia. Dr. On-Calls connect patients with MMC-registered doctors through video, chat, and voice, while Telemed is the platform where not only connect with doctors but also with pharmacists and healthcare lab. Generally, telemedicine is a platform by using virtual software and video software.
My name is Diang and my metric number is 278361. Now I will explain the benefit of telemedicine in healthcare. First is in the field of doctor. Doctor can know the patient health environment and give their suggestion to their family, such as the patient is elderly. If the distance between the bedroom and toilet is far, it is a huge challenge for them. While telemedicine also can help patients feel more anxious, because when it was in their own house, they can explain the problem more clearly, and this can help doctors to make decisions about which method shall be used. Second is in the field of patient. For patients, telemedicine is more convenient and won't disturb their schedule, while also can give awareness to patients about certain diseases to prevent. The last is the patient condition can be monitored 24 hours to ensure they are healthy. For example, the patient with malnutrition. The doctor can monitor their daily meal and give their some suggestions to make sure they achieve the balanced nutrition. Third is the neuroscience. While diffusion of treatment options with television before transfer can help the family physician to manage some simple head injury, this indirectly can help reduce cases of death for head trauma, while television also can solve the problem of lack of neurosurgeons. The use of television would enable neurosurgeons to broaden their expertise to areas where there are no specialists. The last is the field of orthopedic surgery. While there is a financial report showing that the orthopedic with television can save around 45% of direct costs, which include accounting for personal costs, service charges, material expenses, and travel.
Hello, my name is Supesona Muke and my metric numbers is 278181. Today I will talk about challenges telemedicine in healthcare. Firstly, lack of interoperability with EHR. Physicians expected to spend a considerable amount of time within EHR. It can create more work for them. Secondly, it needs proper bandwidth for image resolution and video quality. The low resolution footage filmed by provider was required for healthcare application. Resolution and accuracy of digital video camera have increased significantly. Thirdly, difficulty of managing treatment. Patients get the treatment online with their physician. Reimbursement restricted. Telemedicine reimbursement are not viable model for most organizations. Technological problems such as low call efficiency can make abandonment of telemedicine. Next, patient loyalty, acceptance, and retention issue. Lack of sense of personal touch and will create difficulty with patient. Patient actually less a feeling of human interaction because of online telemedicine. Next, issue of diagnosis and analysis. Conditions that need an in-person review such as bug bites and pneumonia. Next, the standard of treatment and consistency of care. Telehealth treatment can reduce the cost of telemedicine. The next is burnout for physician. For physician, probably a major problem for healthcare system and doctor because it's hard to make a review. Next, concern over Medicare and Medicaid refund. The applicability of telehealth has been suppressed for years because of concern over Medicare and Medicaid refund. Next, the restriction and law on telehealth. Healthcare provide most in good faith provide telehealth service to patients using remote communication technology. Concern over privacy and protection. Telemedicine is a virtual bilateral contact between provider and patient, exchanging information on health and medication. There is unstable concern about possibility infringements of privacy, particularly for patients. Integration of clinic and problem of implementation. It may appear overwhelming to incorporate and introduce a virtual treatment option inside a hospital.
My name is Heng Yong Wei and my metric number is 278147. Today I will present factor of telemedia in healthcare. Internal and external factor affect telemedia. Internal factor apply to the mindset and the external consider relate to the climax surrounding the use of the device. The first factor is telemedia help therapists and participants to be involved and inspired. Video conferencing can empower excellent body language and contact between patient and therapist, thereby increase the certainty of patient. A lack of eye physical and social interaction during online consultation. This may also be a barrier. The second factor is the safety and security of the system. The sense of security when performing online consultation at home, despite the specialized effect to ensure data security and privacy for patients. A few patients remain concerned about the security of the system and their individual security. The third factor is internet affect the efficiency of the meeting. For the high-speed internet tend to have greater satisfaction and appreciation of online consultation, while for the low-speed internet affect the acceptance and fulfillment of telemedia by patient. The next factor is distilled network administration and remote flag scope. This may arise either from problem with the network administration and scope itself or from the indoor and open air barrier at home. This will affect internet speed, and this illustrates a relationship between weak network and slow internet speed. The next factor is the relationship between administration and patient reinforcements can be strengthened by the ability advised by online consultation. In terms of selecting an appropriate time for online care, tracking and monitoring the progress of patient treatment in real time as well as citizen patient in an appropriate manner. The other factor is openness to special care, as it advances the access of patient to master of healthcare despite the further area of patient and the need for specialize in their field. The last factor is a social risk. In modifying, using and retaining telemedia facility, the social and social environment of individuals living within the region, peer colleges, and individuals of a nation create a few barriers. Getting component model and upgrading social station engine individual to update new technology and serve as a barrier without the same barrier. Thank you.
As we all know, COVID-19 is a global pandemic. Malaysia is one of the countries that has been infected by this deadly disease. We can discover that the amount of patient COVID-19 is getting higher day by day, and based on Institute of Health Metric and Evaluation IHME model, predicted that Malaysia case will arise to 5,000 cases per day and a total number will reach 1,325 COVID-19 deaths by April 1, 2021. Based on the increasing number of cases COVID-19, IHME has projected that Malaysia would need more invasive ventilators up to around 40 per day by January and 89 per day in April, while the intensive care units ICU beds required is also projected to increase up to 89 per day by the end of March, which is below the actual capacity of ICU in Malaysia of 293 beds. Now, how telemedicine is performed in Malaysia? Telemedicine can typically be administered by text-based technologies such as SMS, video chat or email. Second is audio-based technologies such as a mobile call or an internet voice call. Third is the technology focused on video such as remote video call or FaceTime. Online telemedicine system existed in integrating these technologies such as Doxy.me, Doctor on Call, BookDoc. This enable physicians to make clinical decisions remotely. This evidence proof that Malaysians should start using telemedicine for their own safety and also reduce the burden of medical centers.
In conclusion, I would like to say that telemedicine is a strong option for patients who can get easily to their medical practitioner and make healthcare more accessible through technology. Telemedicine should be taken as a proactive step to improve medical care and should not only be used as a temporary fix in times of emergency. Telemedicine has become a convenient way for the public to access useful information and consultation on well-being. While the use of telemedicine is increasingly expanded, telemedicine acceptance is still limited even though it has given many benefits to the doctor, patients, and neuroscience despite when the world is facing the COVID-19 pandemic. Telemedicine actually is not intended to replace in-person healthcare, but it is alternative healthcare during this pandemic and even after the pandemic.